Okay, so for literally millions of women, polycystic ovary syndrome or PCOS is a really familiar and, let's be honest, frustrating diagnosis. But what if the way we've understood it for decades is just fundamentally backwards? Let's dive into some research that is completely turning this diagnosis on its head.
We're all pretty familiar with the standard definition, right? PCOS is a hormonal disorder. The problem starts in the ovaries, and it leads to all the things we know: irregular cycles, fertility issues, and those little cysts you see on an ultrasound. This is the classic textbook explanation we've all been told.
But what if that's just the final chapter of the story? What if the ovaries aren't actually the villain here, but are really the victim? And this right here is where the narrative starts to get really interesting. So, this whole thing started when a team of researchers decided to challenge the absolute core assumption about PCOS. Instead of starting with the ovaries as the problem, they began to wonder, wait a minute, have we been looking at this entire condition from the completely wrong direction?
They posed this pretty radical question: is PCOS the root disease itself, or is it what they call an epiphenomenon, which is basically a fancy way of saying a secondary symptom? A downstream effect of a much bigger issue that's happening somewhere else in the body.
Okay, so if PCOS isn't the starting point, then what is? Well, researchers found a massive clue by looking back at the medical histories of over 170 women. And what they found was this surprising pattern that came first.
And that clue? Well, it can be summed up in this one pretty staggering number: 97%. So what on earth does this number actually represent?
Well, it means that in this particular study, a full 97% of women who were diagnosed with PCOS had gained more than 4.5% of their body weight before any of the classic symptoms even started to show up. The critical point here is the timeline. The weight gain wasn't a symptom of PCOS. It was more like the prologue to the whole story. And get this, it wasn't just about becoming overweight or obese in the traditional sense. The study found that even women who had a totally normal BMI still developed PCOS after this kind of weight gain. So the key factor wasn't the final number on the scale, but the metabolic shift that this change in weight actually triggered.
So how does a relatively small shift in weight manage to set off such a major hormonal problem? Well, the best way to think about it is like a metabolic domino effect. One little change triggers another, which then triggers another, all in this predictable, cascading chain reaction.
Let's walk through it together. First, that weight gain changes the body's metabolic signals, which leads to higher insulin levels. Now, that high insulin causes a drop in this really important protein called sex hormone binding globulin, or SHBG. Think of SHBG as a sponge. Its main job is to soak up and bind to testosterone to keep it in check. So when there's less of this protein sponge available, you get more testosterone just left free and active in your bloodstream. And it's this high level of free testosterone that ultimately messes with the ovaries, disrupts ovulation, and produces all the symptoms that we call PCOS.
And that just perfectly illustrates the new theory, doesn't it? The ovaries aren't just misfiring on their own. They're actually responding exactly how they're supposed to, just to this really chaotic hormonal environment that was created by metabolic changes that started somewhere else entirely. They're simply caught in the crossfire.
Now, shifting our understanding like this has massive implications, especially when we start talking about things like pregnancy and treatment. I mean, if we've been getting the cause wrong, we've almost certainly been focusing on the wrong solutions. Take a 2017 study that looked at pregnancy complications. For a long time, we've thought that just having PCOS itself increases these risks. But what this study found was that the main risk was for gestational diabetes, and that risk was actually driven by the mother's BMI, not her PCOS diagnosis. In fact, women with PCOS who had a normal BMI had pretty much the same outcomes as women without PCOS at all. So what does this all mean for treatment? Well, the old focus was all about the ovaries, using medication to force ovulation. That's basically just treating the final symptom in the chain. The new focus shifts everything upstream. The goal is to correct the underlying metabolic imbalance, maybe through weight management or improving insulin sensitivity, and then let the reproductive system fix itself. When you put all this evidence together, it tells a completely different and frankly a much more empowering story about what PCOS really is. And if there's one single thing to take away from all this, it's this. PCOS may not be a primary disease of the ovaries at all.
Instead, you can think of it as the body's very loud, very clear alarm bell signaling that the underlying metabolic system is out of whack. As the lead author of these studies, Dr. Pandian puts it so clearly, PCOS is not an independent culprit. The real drivers are the weight gain and the metabolic status that came before it. This shift in perspective it's profound. It moves the focus from trying to manage an ovarian disease to trying to heal a metabolic imbalance. And it leaves us with a really powerful final question. If we've been looking at a condition this common from the wrong angle for so long, what else could we understand differently if we just started asking if we're looking at a symptom or the real root cause?